Hello again and welcome to the weekly report on COVID-19 for the city of Fredericksburg. I'm Fire Chief Mike Jones to provide some numbers and additional information as we move through this pandemic together. First, the numbers are looking positive again in the situation where we're getting better with this pandemic and the Delta variant that has proven to be very difficult of a challenge over the last several months. But the numbers continue to decrease. We're down below 10% positivity throughout the health district. That's a good sign. As recently as a month ago, we were well above 12%. So now we've dropped several percent below that, and it's kind of looking like it's going to stay there. So that's a good thing. The number of people that are sick with COVID in the hospitals in the health district has also dropped. We're now running right around 50 people in all the health district hospitals total. 2 weeks ago, we were above 70, and a month ago, we were around 100. So we're starting to see positive gains in that situation where the number of COVID cases is reducing and the number of people that are severe enough to be sick in a hospital is also reducing. If you look at the Mary Washington healthcare statistics for the latest version that came out the end of last week, their numbers have dropped, and the number of people in the hospital that are vaccinated that have COVID have also dropped. It is still quite mainly the people that are unvaccinated that have to be hospitalized. Let's talk a little bit about vaccines and some positive things going on with vaccines. As you know, the health district started a community vaccination center. They located that in Central Park. The address is 1877 Carl D. Silver Parkway. And in the first week of having that community vaccine clinic open, they registered and were able to give out more than 2,100 doses of vaccine. And that clinic is open for appointments Monday through Saturday. It's only closed on Sundays. So if you need to get a vaccine, whether it be a first dose, a second dose, or a third dose, by all means, schedule an appointment and go out to that location in Central Park and get your vaccine. They're certainly available. They have all three vaccines available, both Pfizer-BioNTech, Moderna, and J&J are all available on that site depending on what you want to get. And the third dose is available for those that want boosters. Some additional information about vaccines. Last week, the Food and Drug Administration, or FDA, did approve on an emergency use authorization the Pfizer-BioNTech vaccine for use amongst children 5 to 11 years of age. Now, it still has to clear the Centers for Disease Control hurdle, and those meetings are scheduled for tomorrow and Wednesday of this week. If the CDC gives approval of the FDA recommendations, then probably sometime starting next week, the Pfizer-BioNTech vaccine will be available under an emergency use authorization for those individuals aged 5 through 11. So that's a good news for that, being able to get our youngest and our school-age children vaccinated against COVID-19. So I think that is positive. Also, for those that have weakened immune systems, those that are immunocompromised, the FDA and the CDC have come out with an approval for an additional dose of the vaccine. So if you've had the 2 doses of either Pfizer-BioNTech or Moderna, or if you've had a single dose of J&J to start off with, and then you've got a booster dose of either the J&J or the Pfizer-BioNTech or Moderna, you're now 6 months after that booster dose, you now will be eligible for a 4th dose. But that's only for immunocompromised and people that have weakened immune systems. Everybody else doesn't need that 4th dose. But I think those things are positive. They're also working on a situation where they can determine if you can mix and match vaccines. We've always been told in the past that you have to have both, if you started with Moderna or you started with Pfizer-BioNTech, you need to keep on doing that. They're looking at a possibility that if you've had a certain number of vaccine shots, that you may be able to change to get another one, especially if you have certain conditions. So that's a positive front on the vaccine front. So we're moving forward. We're doing better in the community as far as the number of COVID cases. We're doing better in the community as far as the number of people that are sick in the hospital with COVID, the people that are on ventilators, the people that are in ICU. We're also doing and upscaling the amount of vaccines that are available in the community for those that need a first, second, or third shot. I think those are all positive aspects as we move forward through this pandemic. Hopefully we can get even better in the next several weeks. And we'll talk again soon. Thank you.